Hi, my name is Mike Curley. I'm going to be doing the cardiac and peripheral vascular exam. Let me just turn here. Here's my paper. Okay. So first I'm going to be looking at your, I'm going to be looking for jugular venous pulsations. I'm going to be looking at your jugular vein. So please turn your head slightly to the right, I believe. Okay, and move it to the left. Okay. So I inspected both sides of the neck. Jugular veins are flat, so no visible distension or abnormal pulsations. Carotid pulsations appeared visible just above the clavicle bilaterally. The anterior chest does appear to be symmetrical with no heaves, lifts, or retractions. No lesions or scars or discolorations noted. So next I'm going to be palpating the carotid pulse on one side and then on the other side as well. So I'm going to do it one at a time. Sorry, my hands might be a little cold. Okay, next side. Okay, good. Excuse me. Next, I'm going to identify the angle of Louis. So go to the jugular notch, go down. That's the angle of Louis. It's the point where the manubrium joins the body of the sternum. From there, I'm going to walk my fingers to the right, second intercostal space, right there, along the sternal border, so the aortic area. Assessing for any pulsations or thrill. No palpable pulsations or thrill noted. Next, then move over the left second intercostal space. This is the pulmonic area. No pulsations or thrill felt there. I'm going to walk down the left sternal border to the fourth intercostal space near the xiphoid process. There's no palpable impulses or thrills detected. We're going to move on to the mitral area. It's the fifth intercostal space. Left, you're good. I'll make sure I keep you covered. This is the point of maximal impulse, or PMI, which is located at the left fifth intercostal space, midclavicular line. Impulse is brief, light, and if I wasn't able to palpate, I would have you probably turn on your left side to feel a better impulse. All right, now we're going to auscultate. So I'm going to listen to your carotid artery using the bell of the stethoscope. Actually, let's do it while you hold your breath. So just take a deep breath in for me and hold it. Okay, you can breathe normally. So now I'm going to listen to your heart at the aortic, pulmonic, tricuspid, and the mitral areas. I'm going to use the diaphragm this time. So aortic, pulmonic, tricuspid, and then mitral. Okay, now I'm going to do the same thing, but I'm going to use the bell. Listen for more low-pitched tones. All right, so while I was doing that, I was assessing your heart rate and rhythm. I'm listening for any extra heart sounds or murmurs, rubs or clicks. So now if you can turn slightly to your left side, so slightly towards me. Okay, go ahead and zip that up a little bit. I should be done with that. Now I want you to sit up, and then I'm going to have you lean forward, so let me move this. Perfect. Okay. So when I ask you to, I'm going to have you exhale and then hold. I'm going to listen for any aortic murmurs along the left sternal border and apex. So deep breath in, exhale, and hold. Okay, you can breathe. Okay, so you can sit normally. No carotid bruits detected. Heart rate was about 68 beats per minute with a regular rhythm. S1 and S2 are crisp and distinct. No murmurs detected, no clicks, no rubs. Auscultated. No extra heart sounds like S3, S4 heard with the patient in the left lateral position. No aortic murmurs heard when she leaned forward and exhaled. So next, I'm going to take a look at your arms and legs. Just going to take a peek at them. So I'm going to be looking for size, symmetry, any swelling. I'm going to look at your coloring. So I'm just going to be, okay, can you hold this other arm up for me? Okay. And can I look at your nail bed? Turn your hand over for me. Let me see this one. Okay. Now I'm going to take a look at your legs. It's a little dark, so I'm going to use my light. Okay, I'm just looking at your legs for size, symmetry, see if there's any swelling noted just on inspection. Assessing the color, any hair distribution, pigmentation, presence of any ulcers or lesions. And then if you could stand up for me and look at any varicosities on your legs. Okay, you can go ahead and sit back down. So arms and legs are symmetrical in size, with no swelling or deformities. Skin tone is even, consistent with the rest of the body. Nail beds are pink with capillary refill less than 3 seconds. No visible varicosities, scars, or lesions noted. Hair distribution is even from knees to toes. Next, I'm going to palpate your radial and brachial pulses. So if you could hold, let me just see your arm here. Palpate your radial pulse, good, and your brachial. And I check for any lymph node tenderness or swelling. Is there any tenderness? No. Okay, let me move to the other side. Let me just double check. Okay. Radial pulse is good. Brachial pulse is good. No tenderness or anything like that?
No tenderness.
Okay. And I checked your capillary refill already. Next, if you could maybe just, let's see, go ahead and lay back down. Let me move this. Okay, I'm going to check your femoral, popliteal, and posterior tibial pulses, and dorsalis pedis. So, normally you'd be in a gown. I'm not going to make you get unclothed, so your femoral pulse will be about there, on both sides. And check your popliteal. And have you, yep, just and then go ahead and rest your foot down. Good. And next one. You can lower that leg. Okay. Make sure you can see. There we go. Good. And then checked for temperature as well while I was doing that. Checked your inguinal lymph nodes as well. I was checking your femoral pulse. I'm going to check edema at the tops of your feet in the medial malleolus and along the shins. So medial malleolus, I'm going to check. I'm just going to push down. 3, 4, 5. Okay, no edema. No indentation left. Okay, no indentation left there. So pulses are 2+ and equal bilaterally at all sites. No lymph node enlargement or tenderness. Temperature is equal and warm bilaterally. Capillary refill is less than 3 seconds. No pitting edema present. Okay, can you go ahead and sit up? Let's reposition you. Next, we're going to check for blood flow to your hands, called the Allen test. Let's do your left hand first. Make a fist, pump it a few times, and hold. Okay, go ahead and release your hand. Should be a little white. I'm going to release the radial artery. It's hard to see, but yeah, we can see some coloring come back. So then go ahead and do that again. Nope, same hand. We're going to check the other artery. Squeeze, squeeze, squeeze. Make sure I'm on video there. Okay, go ahead and hold your hand out. And we'll release the ulnar artery. Okay, so I did see some pink come back, so that one's good. Keep your hand like that for me. Just wanted to double check. We're good on video. All right, go ahead and rest that one down. We'll do the same thing with this one. Okay, open your hand. Still a little bit white. We're going to release the radial artery. Did see some pink color come back. Do that again. Hold it, squeeze. Okay, and release your hand. Releasing the ulnar artery. Okay, it's hard to see because of the light, but the pink did come back, so that was good. So the color did return. And then, okay, lastly, if you could go ahead and lay back down. I'm going to raise your legs up to about 60 degrees, observe for pallor. And then I'm going to have you dangle them over, and I'm going to check the coloring. I'm going to release your socks a little bit, just so I can check your feet. It's a little difficult to tell on your skin tone, but there's a little bit of pallor. And then I'm going to release your legs and just want you to dangle them, it's on the couch, but kind of just dangle them over the side of the couch. Just go ahead and sit up and dangle. Okay, so we did see some color return. So initially, the palms turned pink within about 5 seconds after releasing either artery, indicating both radial and ulnar arteries are patent. Feet become slightly pale when elevated, then regain pink color within about 10 seconds when dependent. Veins on the feet and ankles fill within 15 seconds-ish. No delayed color return, cyanosis, or dependent rubor observed. Thank you so much for participating.